guys, joint mob time. So our patient presents with decreased range of motion, flexion, and extension. The measurements we got from the objective measurement: active range of motion, right, is lacking 15 degrees of extension and only has 70 degrees of flexion. And his left, we kind of base it off the left side, what's normal for the patient. 0 degrees on extension, so they've got full extension, and the flexion is 135. So we're lacking about 65 degrees of flexion, so limited in both ranges. So we're going to do a joint mob to address both of those. So the joint mob we're going to do, I'm going to show you with our patient Steven as our demo guy. We're going to do right tibia, femur, anterior, and posterior glides 3 and 4. The patient tolerated grades 3 and 4 in the initial eval, so we know we can do that here to try to improve some range of motion. So we're going to show posterior right tibia femur glide. Sorry. So we're going to bend it up to in range as far as the patient can take it. So we got about, said 70 active passively. He got about 75. So we're just going to take that to its in range. Okay. Stabilize. Just going to sit on the foot. Alright, and we're going to place our hands on the tibia, basically where the tuberosity is, just under it, and hands underneath, and thumbs anterior. You're going in a downward glide, and you're going grade 3 and 4, and when you get there, you're just going to oscillate back and forth, checking with the patient to make sure it's alright. We'll do about 5 minutes of that, and we'll switch, and I'll show you. This is improving flexion. So we took him to in range. This is as far as Steven could take it in this range, and we're going to switch and try improving extension. All right. So we'll just have Steven roll over on his stomach. So he's lacking 15 degrees of extension. So we place a little towel underneath the knee for comfort. Alright, stabilize. And I forgot to mention what I was doing earlier. I was distracting as well. So you want to pull back a little bit just to get a little separation on the joint so you can do a glide. So I'm going to stabilize. His knee's stabilized here, and I'm distracting a little bit. And I'm grabbing the back of the tibia posteriorly, and I'm going to go in an anterior direction. When I get to grade 3 and 4, just oscillating back and forth. So we take him to where he's at, and at full extension he would be here at the table, but he's lacking about 15 degrees. So you're here and just applying pressure, and just doing it. A few sets of these. Alright?